How important is an emphasis on nutrition in obesity management?
So it's one of the primary pillars of the treatment of obesity, and every algorithm and guideline out there for the treatment of obesity, understanding the patient and how they're interacting with food. So it's not just what they're eating, it's not just the number of calories that they're eating. It's much beyond that, because we know now that obesity is a hormonal and a brain disease. So it's not just calories in and calories out. It's as much about what they're eating as it is the quantity of what they're eating. So it's really a very critical piece of treating the disease.
Them. A
Okay.
lot of people these days are looking for a sort of one-step fix to their issue, whether it be cardiovascular disease, obesity, all kinds of different conditions. Um, when is it appropriate to start anti-obesity medications? And is that sort of a last line effort, or is this something doctors should be considering immediately when their patient comes to see them for the first time?
So I think that all of us as clinicians should have anti-obesity medications very early in our thought process. And the primary reason for that is that most patients with obesity have already been treating their obesity for years before it gets addressed in a healthcare environment. So these patients have been to Weight Watchers. They've tried multiple types of eating plans. And because they don't understand it, like diabetes or hypertension, as a chronic disease, you're right. They've looked for, quote, quick fixes. And most of them don't understand that hormone of hunger with ghrelin and leptin, as well as many other hormones for satiety, are not well stabilized. The person with obesity has a dysregulation of those hormones. So the medications can help stabilize that and can help support the pillars of treatment of eating plans, activity, and lifestyle interventions. So the medications are not just, this is going to fix it. The medications are there as an adjunct to support the other treatment pillars.
How important is it to make sure that patients understand the individual and combined roles of nutrition and medication when trying to confront obesity?
I think the biggest reason it's so important for patients to understand that, and for the clinician, is because we as a healthcare community have not understood obesity as a hormonal dysregulation and a chronic disease. We totally understand diabetes, we get hypertension, but we've not understood obesity as a chronic disease, nor have we understood that diabetes and hypertension are obesity related complications. So we have to treat obesity first in order to treat those other diseases. And so from a patient perspective, it's going to be really hard for the patients to understand that if their treating clinician isn't understanding it.